So Germany kind of rolled out the red carpet for you all. What type of treatment was it? Was it more drugs? What were they? What did they use? Is it something that's easy to explain, or?
It is something easy to explain. So the clinics over there, there's about 100 German cancer clinics over there, and they all do a lot of the same things with some small differences. The oncologist that we chose to go to, Dr. Alexander Herzog, brilliant, kind, intelligent, one of the top four oncologists in all of Germany, is an integrative oncologist. So why we chose him was because of one sentence that he said, which is, we've had great success with metastatic breast cancer that's moved into the bones. When do you ever hear that here?
No, usually when it hits the bones, it's kind of over at that point, is what I hear. So
It is, and since he's had great success, so the treatment we chose over there, he does do integrative if it makes sense. If they do chemotherapy, it's usually very low dose, nothing like what they do over here. But the treatments that we got, I made a note here,
yeah,
so
yeah.
I would go through them. So their huge claim to fame is they do whole body hyperthermia, and that's heat. So it kind of makes sense. So what they do is they create a um, a fever situation,
Hmm.
and what that does is it kills cancer cells directly, or it weakens them, so that the immune system can then go find them, target them, and do what it needs to do. In the full body hyperthermia is systemic, so it's throughout the whole body. So she had that. She had two of those, and we were talking this morning. We think um, the temperature was 104 to 105 for the full body
How long does that
hyperthermia.
last?
That was a 4-hour treatment, and it takes about
Gosh.
an hour to raise the body temperature to that level, and then they maintain it for 2 hours, and then it takes about an hour to lower it back down. And there's no pain, it's just hot. She
Hmm.
said it was just hot. I didn't get to stay with her for that treatment, but she was monitored by two doctors during that whole time, during that treatment. But then she also had local hyperthermia. So local hyperthermia was this disc that's about this big, and so, since she had breast cancer in both breasts, one day they would put, for an hour, she would have this, this heat directed right at her left breast, and then her right breast, and then her ribs, and then her back. So every 4 days it would change where the local hyperthermia was targeted to kill the cancer cells. And so she had that treatment, and she also had magnetic field therapy. I got my list right here. She had detoxification therapy, and that was intravenous. So there was different things that she got 3 IVs every single day, but they were all like nutrients. None of them were drugs. She got no drugs over there except for her immunotherapy treatment because she was due it. So Dr. Herzog administered that while we were there. She had ozone therapy, oxygen therapy, homeopathic therapy, vitamin C therapy. She had exercise therapy, which was huge. I'll tell you about that. Reflexology therapy, physical therapy, massage therapy, and she would have gotten mistletoe therapy if we had gone back, but then COVID hit, so we weren't able to go back in 6 months, which is what he had initially recommended we do.